Hi, my name is Haley Johnson and I'm doing a presentation on Toxoplasma gondii, the parasite that hijacks minds. Toxoplasma gondii and its impact on the body and brain. Toxoplasma gondii is a protozoan parasite. It mainly affects cats, but can affect other warm-blooded animals and humans. It's a brain hijacker. It hides in the brain by forming cysts and can cause chronic infections. It can alter your dopamine levels, which may affect your mood, your behavior, and decision making. Its effects on the body. For healthy individuals, they usually have no symptoms or flu-like symptoms. For the immunocompromised, they risk serious infection, especially in the brain. Pregnancy can lead to birth defects or miscarriage. Screening and testing for Toxoplasma gondii. How it's diagnosed. They use blood tests which detect IgG and IgM antibodies to see if you're infected or have been recently exposed. They also do amniotic fluid testing for pregnant individuals using the PCR. You can also have MRI or CT scans in serious cases, which shows images of your brain lesions. They do a tissue biopsy, which is very rare, and it's tested if all the other tests are inconclusive. How can you get Toxoplasma gondii? You can get it from eating undercooked meat, especially pork, lamb, or bison. You can get it from drinking contaminated water, handling cat litter or soil infected with feces. You can get it from mother to fetus transmission during pregnancy. You can get it from touching raw meat and then touching your mouth or face. Wash your hands, cook your meat, and be careful with that litter box. Toxoplasma gondii and animal behavior. Real-life mind control. What happens to infected rodents? So, if it's a mouse, they lose natural fear of cats, sometimes are even attracted to cat urine. They show increased risk-taking and less anxiety, which causes them to be more likely to get eaten by a cat, and that causes the parasite to complete its life cycle. In other animals, such as birds, they become disoriented and less cautious. For livestock, they usually have no behavior changes, but infection can cause reproductive problems, miscarriages, especially in sheep and goats, and T. gondii literally rewires the fear response in the brain. Toxoplasma gondii and human behavior. Is it messing with our minds? What the research shows. Alters your dopamine levels, which affect your mood, emotion, risk-taking, and may be linked to increased risk-taking, such as reckless driving. It slowers your reactions times, and it can cause mental health disorders like schizophrenia and bipolar disorder. Behavioral patterns. Individuals may become more impulsive or aggressive. They have a higher likelihood of developing neuropsychiatric conditions, but the research is still going on, but it's very intriguing. Health risks of Toxoplasma gondii in healthy individuals. They're often asymptomatic, but they may experience flu-like symptoms, muscle aches, fevers, low grade, fatigue. For chronic infection, which is rare, the parasite can form in cysts in the body, especially in the brain and muscles, and can remain dormant for life. Even though symptoms are not present, the parasite can still affect the immune system and may cause occasional flare-ups of the immune system's weaknesses through stress or illness. For healthy individuals, Toxoplasma gondii is not a significant threat. However, it is crucial to practice proper food safety and hygiene, like cooking meat thoroughly to prevent infections. Health risks of Toxoplasma gondii in immunocompromised and pregnant individuals. For immunocompromised individuals, such as people with HIV and AIDS, or you're undergoing chemotherapy, or you're on immunosuppressive medications, are at high risk. Reactive of latent infections can lead to Toxoplasma encephalitis, which is a life-threatening brain condition. Symptoms can often include severe headaches, confusion, seizures, coordination problems, and in extreme cases, it can put you in a coma. And it can also affect your eyes, lungs, and other organs. For pregnant individuals, first-time infection during pregnancy can pass the parasite to the fetus. Congenital toxoplasmosis. Risk to the baby depending on the timing of the infection. Early pregnancy is a higher risk of miscarriage or stillbirth. Later in the pregnancy, risk of birth defects including hydrocephalus, which is fluid in the brain, seizures, enlarged liver or spleen, hearing loss, or intellectual disabilities. Treating and preventing Toxoplasma Gondii infections. Treatment options. For symptomatic or high-risk individuals, they often get prescribed an anti-parasitic, often combined with sulfadizine and folinic acid. For pregnant individuals, spiramycin to reduce the risk of fetal transmission. If fetal infection is confirmed, they use sulfadizine under medical supervision. Monitoring and supportive care. Regular checkups, especially during pregnancy or if immunocompromised, MRI or CT imaging, and lab tests in severe cases. To prevent, we use food safety. Cooking the meat thoroughly, washing the fruits and vegetables, avoiding raw or undercooked seafood or unpasteurized dairy. General hygiene, washing your hands after gardening or handling raw meat. Avoid untreated water when traveling. Freezing meat before cooking. Freezing can kill parasites. A tiny parasite with a massive impact. There's still so much to learn. And there's my references.